Good evening, ladies and gentlemen. I'm Elmarie Jooste from Executive of Corporate Relations and Wellness. Let's give another few minutes for people to join and then we will start. I don't think there will be a lot in this session, but let's give them another minute. I think the fact that it stopped on 20, we can proceed. As I said, I'm Elmarie Jooste, and I'm going to go through the Rhythm1. Now, the Rhythm1 option is relative new. We've launched it in March or April this year, and it replaced Pulse 2. In a sense, what we did is we took Pulse 2, the old Pulse 2, and we revamped it and created this option, and then we renamed by Pulse, what was it first? Pulse 2 to Rhythm1, and we then renamed Pulse 1, Pulse 2. So the rhythm options are the options that it's kind of standalone from the rest of the product range, which is the beat and the pace products. And it is pure network options, which means that you don't have, or you have a freedom of choice within the network. And we created Rhythm1. You will see that we tried to reduce the cost of Rhythm1 so that it's our low-cost product, and it's aimed at those who start working for the first time or entering into the medical scheme industry for the first time. And the focus of Rhythm1 specifically is more on primary care out of hospital than the care in hospital. And you will see that when we go through the slides. Babalwa last week presented Rhythm2, which is one of my favorite products because Rhythm2 have much more comprehensive hospital benefits, plus then the unlimited primary care, and together it makes a huge, a good offering, especially for single parents, according to me. So Rhythm1 is, as I said, focused on primary care, and but it does offer hospital benefits and then the out of hospital. But you will note that the out of hospital is focused around primary care and what the average person needs during the course of the year with regard to primary and out of hospital care or day-to-day care. But it doesn't have a savings account, and it doesn't have supplementary benefits. So as soon as you start needing something more than the basics, this option will not be suitable for you. Even Rhythm2, if you start needing specialized care or psychologist consultations or physiotherapy, supplementary additional services, the option won't be suitable in terms of your needs. So if we look at hospital cover, the same rules apply. You need authorization and you need to phone BestMed, give all the detail. Most often the specialist will provide you with the code to send that through. Now, how Rhythm1 differ totally from any of our other options is it covers mainly the prescribed minimum benefits in hospital. So remember at the other sessions, I've said that we have a list of 272 treatments or procedures that we need to cover on all our options. Now we've limited the hospital benefits to those 272 procedures and treatments. And that was in 2022. So what we've done is for next year, we've added 9 non-PMB day procedures or procedures that can be done in a day hospital. And the rule that apply there, those 9 conditions or 9 procedures that's in addition to the PMBs that can be done or should be done in the doctor's room. But if the doctor doesn't have the equipment, then it needs to be done in a day clinic. Now, the PMBs, the 272 procedures or treatments that you receive in hospital is unlimited. There's no annual limit applicable to that, but the 9 non-PMB procedures that's done in the doctor's rooms, that is limited to 50,000 Rand per family. Then we still cover treatment in mental health clinics for 21 days. There's takeaway home medicine to take home if you're in a hospital. I must focus a little bit. And then the dental and oral surgery, you will see that the wording PMBs at DSPs or limited to PMBs at DSPs, that's frequently part of this presentation because the option is built around the prescribed minimum benefits that by law we ought to cover on all options. We created an option that we only cover that, but we did add now the 9 procedures to it. We exclude joint replacements except if it's a PMB, similar to beat 1, beat 2, and beat 3, as well as PACE 1 and beat 4. Refractive surgery for the eyes only when it's a PMB. And the DSP is a designated service provider for the Rhythm products, and that is Rhythm 1 and Rhythm 2, is Netcare. So if you are hospitalized, you need to go to a Netcare hospital. If you are in an accident and the ambulance come in and take you to the nearest hospital and it's a Mediclinic, then it's fine. We will treat you there till you're stabilized and then transfer you to the Netcare. If you voluntarily choose to not go to Netcare but to go to Life or Mediclinic, then there's a co-payment. You will note that the Rhythm product have a lot of unlimited out-of-hospital benefits, but it's linked to rules. And if you're a person that can cope with the rules, then you will be happy on these 2 options. If you don't like rules and to be told and to follow a certain procedure, then you're not suitable, your personality for the product. I don't know whether this is appropriate, but these 2 products remind me a lot about say, for example, the Defense Force or the Army, those places, the police, not Paul Met so much, but the Army and the Defense Force, if they medical aid, they must also you need to go to the Defense Force medical services, the nurse, the doctor. You can't go anywhere. You need to be referred. Now, that kind of environment is exactly what apply on this option as well. Now, we've covered the hospital cover, the day-to-day benefits or the out-of-hospital benefits is built around, again, and I'm going to repeat myself a lot, it's primary care. Now, primary care is that first level of treatment that you need, and that is unlimited, provided that you make use of a Rhythm Network GP. FP stand for family practitioner. I'm not there yet. I'm still old school, but call it GP. Now, within the BestMed GP network, the bigger network that all our members, or most of our members, make use of, there's a subgroup of doctors, GPs, and they are called our Rhythm network. Now, you have access, if you on this option, to unlimited GP consultations, provided that you make use of a Rhythm GP. Then I've removed it, and Ronsley, who's managing the queries of this option, put it back. After the 10th consultation, and I must say it then, after the 10th consultation, consultation number 11 will be pre-approval will be required, which means that we just want to know, because the average person go to the GP 6 times a year, between 4 and 6. So if the patient, and it's per beneficiary, so if the beneficiary goes, it's now the 10th consultation, he or she either is extremely ill, or the doctor doesn't know how to treat you. And that is why we require then pre-approval for consultation number 11. The reason being, so that we can review the treatment that the GP gave you and determine why can't they get you healthy. And I always say it all depends on the looks of the GP. I can understand if you go every week, if it's a handsome person. Otherwise, the average number of people, or average number of consultations that people make use of is about between 4 and 6, and in some cases 8, especially for babies or small children. So, but we won't say you can't go, but what we might do is to refer you to another GP, so that perhaps the one that you consult is not of good quality or doesn't know how to treat you. So you have access to unlimited Rhythm network GPs. The second thing is you have access to private nurses in network pharmacy clinics. And I've listed Dis-Chem and Clicks. It's not only those two, but it's easy to understand. You will note that, or if you were at the session when Bababa explained Rhythm 2 last week, she noted that this benefit is not on Rhythm 2, it's only on Rhythm 1, the private nurses. That's the consultation that's unlimited. The reason why we've included it is basically the profile of member that we want to attract with this product. It is healthy people that focus on day-to-day treatment and stuff, that sometimes a nurse can provide you with the care, and you have a stomach ache and she can recommend something. And that is why we've included in the Rhythm 1 product. Then with regard to specialist visits, you need to be referred by your Rhythm GP, and this is where the rules comes in. You need to be referred by your Rhythm GP to go and see a specialist, and the specialist benefit is limited to only when it's a PMB. But remember what we said with the other options is the 27 or 26 CDL conditions. When you register for those chronic conditions, you receive a treatment plan. And in some of those treatment plans, there's a specialist visit included. So if you have hypertension, there might be a specialist visit part of your treatment plan. You still have access to it on this option because it's prescribed minimum benefits. you need to go to Rhythm Specialist Network, and most of the Rhythm GPs will stick to the rules and refer you to a rhythm specialist. But if not, then you need to remind him that you're on Rhythm1, you need to go to a rhythm specialist. Again, it's a specialist network within the normal BESMET network. Then with regard to dentistry, this option covers basic dentistry. So scrub, skeet, and polish, I always say, and then extractions, fillings, the basic dentistry. If you are moving in a direction where you would need specialized dentistry, like for example, Crohn's, there's no benefit. Again, what I've said in the beginning, it's what the average person that need, as soon as you need something advanced or more comprehensive care, then this option will not be suitable for you. The rhythm, you make use of, there's a rhythm dental network. So we have a dentists that's part of the rhythm network. You must make use of one of them. They have lists of codes that will be paid, and they know it, and they will follow the BESMET protocol with regard to that. They understand that it's basic dentistry only. With regard to dentures, you have access to it, limited of a maximum of 2 removable dentures per family every 2 years. So you can understand this is really the basic. We try to keep the cost as low as possible. And now the benefit that I love the most, except for the unlimited GP consults, is you have unlimited acute medicine benefit or access to it. Acute medicine is anything that's not authorized as chronic, not anything, but you will understand when we go through the chronic. So if one of your conditions are not, acute medicine is like flu medicine, that's the best example. So if you have flu and you go to your Rhythm GP, he will prescribe you flu medicine. You go to a network pharmacy, which is, there's an extended list, but I usually say Discom and Clicks because everybody knows them. And then you will obtain your acute medicine from that pharmacy. We do have dispensing Rhythm GPs where they will then issue you with the medicine. There's a formulary applicable, but the benefit is unlimited. Then pathology and radiology, the same. You can't go directly to a pathologist or you go directly for x-rays to somebody. You need to be referred by your GP and your Rhythm GP. He has a form that he will complete, give you the form and refer you to a rhythm pathologist. He will only ask for certain codes or tests to be done. That's per our protocol, and he will use the right codes. And then the same with radiology. Your Rhythm GP will refer you. Basic x-rays are covered, and it's subject to the rhythm protocols, and they will use the rhythm codes. We rely a lot on the Rhythm GP to also follow the rules, because it's unfair if a patient consults a Rhythm GP and then he just sends you all over and it's not covered. Because with the purpose of these two products is that whatever you obtain, there shouldn't be a co-payment, because you need to make use of rhythm providers, and we've negotiated in that manner. Then optical benefits is not really optical benefits. It's a whole slide of text, but what we cover on this option is only the eye test. And you need to go to PPN providers, and that is why the detail of the PPN providers are included there. So if they did the eye test and they found that you need glasses, then you will have to pay that from your own pocket. We might in future add it to the benefit structure. Maternity benefits, we cover the same as what we cover on beat 1 and beat 2, which is 6 antenatal consultation. But in this case, you need to make use of your Rhythm GP or then a Rhythm or a DSP gynecologist or midwife. So within the network. And you also have access to the 2 ultrasound or scans. But it's important to know that the Rhythm GP will refer you then for your scans. Good. So the option does include preventative care benefit, flu vaccine that you get from your Rhythm GP or your network pharmacy, vaccines, contraceptives that you will obtain via from the network pharmacy, the back and neck program. But remember, it's important to understand that the back and neck rehabilitation program is only as a substitute for the operation. So your back and neck need to be in such a state that you need a back operation, and then as an alternative, they will authorize it that you go through the program to prevent it, to see whether it can prevent you to be admitted and have the operation. So it's not really a preventative care benefit. It prevents you from being operated on, but it's not preventative care in a sense that it is like a biokineticist stretching and all of those. With regard to baby growth and development assessments, every baby have 3 assessments per year, and it is for children from birth to 2 years. The wellness program is offered to everybody. It's a standalone. You too, if you choose this option, have access to currently the biokineticist and the dietitian. And next year we will add then the online program or journey where you set your own goals and you connect with your wearable fitness device. And with regard to nutrition, you can choose whether you want to consult with the dietitian or not, but you can also follow the journey online. Then we recently launched emotional well-being. You will note if you download the app, it's available, or if you go to the website, it's already there. There's 2 assessments that determine the level of depression or symptoms of depression rather, and anxiety. You will do the test, and then based on that, they will send you a report. But if you don't need to do that, there's other elements of the program also available where you, for example, if you struggle with rage, I think everybody has rage at this time of year, or you feel that the in-laws are working on your nerves, then there's some stuff to listen to or videos to watch, news or articles to read that provide you with practical advice on how to cope, especially during the December holidays when it's the children is at home as well as the in-laws, and it's holiday and everybody work on each other's nerves. Please test the program and determine whether it's worthwhile doing the challenges. It's focused on skills development, so it's very practical. And if 18 years and older people have access to it. Now, with regard to the medicine benefit for the option, we cover on Rhythm1 the 27 CDL conditions, as well as the 18 PMB conditions that include medicine as part of the treatment. So with regard to the CDL conditions, there's 27 sickness conditions that the Department of Health and the CMS has prescribed all medical aids that you need to cover the medicine as well as the treatment for that condition. And the treatment is prescribed. We don't decide on it. The Department of Health gave us a treatment, an algorithm that we then incorporate in when we authorize your medicine for the condition, or we register the condition rather, we will send you a treatment plan. Say, for example, you have asthma, we will include the authorization for asthma, and then the additional services that the average patient with the condition needs in a period of 12 months. And that might include a lung function test, a GP visit, and a specialist visit. And it's linked to a sickness code or ICD-10 code. And if you use, the provider need to use that ICD-10 code on the invoice or the account because we need to pay it in, and it needs to trigger the authorization that was loaded so that we pay it from the right benefit. If you need to go back, if you diagnose with any of these conditions, your primary caregiver is still your Rhythm GP and a network specialist. And then you must obtain the medicine from a network pharmacy. So it's similar to the BEAT1, but in the BEAT1 case, you can consult any GP and any specialist. On Rhythm1, you need to stick to the Rhythm network of specialists and GPs. Now, the medicine that you qualify for is also, we work according to medicine list that we call a medicine formulary. And there's no limit to those medication. In other words, you can't run out of benefits for the medicine part of the 27 CDL conditions. But if the item that was prescribed for you is not on the formulary, then you have a 30% co-payment, which is very high. If your medicines are expensive, it's a third of the cost. So the Rhythm doctors have access to the formulary, and they should be able to prescribe something that's on the formulary in order for you to prevent that the co-payment. Then new members, if you were on another scheme and you joined BestMed, all that we ask is a letter that proves from your previous scheme that state that you receive medicine for these conditions and the latest script or prescription. So then you need to submit that with your application and we will authorize it. Then you don't need to go through the whole process again. Any questions about your chronic medicine, the 27 sickness conditions, or the formulary or anything like that, you need to send that through to medicine@bestmed. So the second group of sickness conditions are, remember I said we have, there's a list of 272 sickness conditions that by law procedures and treatments that by law we need to pay for on all the options. Now, these 18 conditions are part of the 272 that include medicine as part of the treatment. And we will cover that on the Rhythm1 as well. All that we need is that your Rhythm's doctor or the specialist need to complete a PMB form, submit that. We again work based on a formulary, and if the item is not on the formulary, then there's a co-payment. Now, how do you avoid these co-payments? I hope it's easier for a rhythm patient because the rhythm GPs and rhythm specialists know that they need to prescribe something from the BestMed formulary, but you will see in the authorization letter that we sent you, if something was prescribed and that's not on the formulary, we will list just at the bottom of the table, we will list the items, the generic items that's fall within the MRP, that medicine reference price list. So we will list the alternatives that the doctor can prescribe. And you need to obtain it from network pharmacies. I've listed only the two, there are more. So that is the medicine. So if we go back to the acute medicine, remember acute medicines is mainly a once-off antibiotics or flu medicine, painkillers, acute or medicine that's not authorized as chronic, but we work according to a formulary for that as well, but there's no limit applicable. Contributions, you pay on this option for each child you have, you will always do, but we regard children as, or young people as children up to the age of 24. You pay a child dependent fee, and then if it's a student, they qualify up to the age of 26 to pay child dependent fees. Now, this is the only option that we have that make provision for income categories. So the higher your salary, the more, or the higher your subscription would be. If you earn less than 9,000 Rand a month, you will pay 1,307 Rand. And if you earn between 9,001 Rand and 14,000, you will pay us 1,525 Rand. You will see if you earn more than 14,000 Rand, it's clear that you could have been on Rhythm 2. That's a more comprehensive option because the cost is relatively the same. So this option is aimed at the lower income part of society. And it's important to remember that it includes basic primary care, and that is unlimited. But hospital care, we limit that to prescribed minimum benefits, as well as then those 9 additional procedures. This slide includes all the detail on how to reach out to BestMed in there. You know about our app, download it, because then you can clearly see, and you can also see who's on the network, the Rhythm network. If you have any questions, we're going to answer it now, some of it, but if it's private and personal, we would appreciate it if you send it to service@bestmed and let somebody go on the system, find the answer, and answer you in writing. And that is it. I'm going to try and see whether I can open this so that I can see. If you have a question, please raise your hand. There's already one. I must just remember to look in the right screen. Dawn?
Hi, can you hear me?
Yes, I can.
Hi, thank you for the presentation. This whole scheme, sorry, I'm an ex-Nedbank employee, so I had to retire. I just wanted to find out, I've got a face-to-face appointment with Alexander Forbes next week. And if I want to change my plan from, I'm currently on, I think, pace 1, will he be able to assist me with the new change of plan forms application forms, or do I have to download them?
No, they will be able, if you have an appointment, they know exactly, they do the option changes for NetBank because it worked via the HR, I think, but it's on their system. They have access to it, so you will be able to give it to you.
All right, so he can help me with the filling in of the forms if there's a change of plan.
Yes.
Super, thank you very much, Marie. I appreciate that.
Is the sound coming from you, your mic and not mine, eh? The birds or is it only me who heard that? All right. Now I can't see that small screen. Mr. or Mrs. Damoy. You can just unmute yourself, please.
Yes, can you hear me?
Yes, I can. What's your name?
Ineziwe.
Very beautiful.
Thank you for the presentation. I have a concern here. I'm currently on the Rhythm1 and I'm currently pregnant and I'm currently having a chronic disease. So right now I want to change to upgrade to beat 1. Will that not affect me during my time of delivery?
No, it won't, because the delivery will be paid on beat 1 as well as on Rhythm1. So you now on Rhythm1 you want to change because it's a lateral change. It's not an upgrade to beat 1. You can I be very honest with you?
Yes.
You need to think very carefully. If you're now on Rhythm1, you have access to GP consultations and you have access to acute medicine, which you don't have when you change to beat 1. And remember, your baby is going to be born, and a baby sometimes need a lot of, going to the doctor, get a script, get medicine. So, and if you're on beat 1, it's a hospital plan. You don't have any. All of those kind of things are paid from your own pocket.
Oh, okay.
Yeah. So, yeah.
I'm trying to think, with this Rhythm1, can I add another member and the baby?
Yes.
I can.
Are you? Yeah. If you're already on the Rhythm, then if the baby's born, you can add him. Remember, it all depends on. I've just said now, if the baby is born from you, then you can add it because then it's your dependent. The other one, I'm not at liberty to know whether we're going to underwrite them or not. But if you're part of a corporate, you will definitely have an advisor that will be able to help you with that. But I would not, all I need to say is I would not change from a Rhythm to beat 1, because especially after the baby is born, you will need GP consultation.
Oh, okay. Thank you.
Anybody else? What you can think of, sorry, I'm get a little bit carried away, is look at the Rhythm2, but I know it's much more expensive than the Rhythm1, but look at Rhythm2 because it offers you more benefits. It's the same structure, but it offers you more, but it is more expensive than Rhythm1. Okay. Right. If that is all, did we answer all the questions that's in Q&A? Then, ladies and gentlemen, this was the shortest session that we ever had. So thank you for your attendance. And this is also, believe it or not, the last session for the year from the BestMed team. So I just wanted to make use of the opportunity to thank the marketing team and Jess, who always are ready and keep calm and get things going. And to the team at the back who answers your questions in the Q&A and chat functionality. They, as we carried on, got less and less people on the panel, but still there's always somebody that helps us with the questions. I want to thank that team that do this. We do it after hours, so it's not the most enjoyable time for people to work, but they do it with a smile. And then I want to thank you for attending and make this worth our while to present. Thank you, everybody, and have a good night. Also, before I forget, to the communication team who design and compile these presentations that I usually change at the last moment and last minute, I apologize again, but I thank you. Have a good evening and weekend. It's close to weekend. Just think of it. Thank you so much.